everybody, Alice here. I'm a doula, a childbirth educator, and I love talking about birth and the topics of the wheel. Let's spin it and see what we're going to talk about today. Okay, today we have after the birth. Cool. So what this means, I wanted to talk about sort of what are some normal things that happen immediately after a vaginal birth, because I get this a lot, because I hear a lot from people, why didn't they tell me about it? Why didn't people tell me this? Why did people tell me that? So I wanted to talk about what happens within that first hour after you give birth vaginally. So one of the most important things for the person giving birth to do is just to hold their baby skin to skin. And we did cover skin to skin on a video to check out, and I'll put the links down below. So that's really the top priority, is to hold the baby. So while you're holding baby skin to skin, whoever caught your baby, whether that was a midwife or a doctor, what they will do is deliver the placenta. And so after the placenta comes out, then your provider, midwife or doctor, are going to assess your tissues to see if you had any tearing, if they did an episiotomy, or if everything else is intact and looking good. And so if there was an injury to the tissues, either with a tear or an episiotomy, it's usually at this time that a repair is done. So that would be doing stitches to repairing the injury of your tissues. Now, it might seem kind of harsh that this is done so quickly after birth, but that's the best time to repair the tissue. And you'll be holding baby, hopefully, skin to skin. And so you can be somewhat distracted about what is going on with your tissues and the stitching. But if your care provider, definitely make sure that you are numb. Either if you have an epidural, they'll make sure that the epidural is still covering so that you aren't feeling that stitching. And if you don't have an epidural, then they will give numbing medication. And the initial repair, putting the numbing medication in can be uncomfortable. And I always suggest that people use their same breathing and relaxation techniques that they did during birth, during that part. But then after the area is numb, usually there's not a lot of discomfort in that repair. So after the birth, you'll be holding skin to skin. Your provider will deliver the placenta, then will do any kind of repair, check, and make sure that your tissues are ready to go. Other things that's going on after the birth is that there will likely be a lot of people in your room doing different tasks. So they might bring in a couple different nurses, maybe to help check on the baby, depending upon how your facility manages care after the baby is born. Sometimes there's just another nurse in there to help take some charting on the computer, you might notice. There might be some other personnel that come and help sort of manage putting the bed back together if they took the second half of the bed off for you to give birth. Kind of depends on your facility. So you might notice a few other people whirling around your room, busy with different tasks after the birth. Again, your job is just to hold that baby and meet your baby with your partner. Other things that happen after you give birth, you might experience shaking, postpartum shaking. So because such a huge change has happened in your body, you had this whole person inside that is now on the outside. So it's a big temperature shift in the baby being born. There's also a lot of hormones that are surging and rushing through your body. And a combination of those can really cause some postpartum shaking. And it's almost can be like this. Like I've had clients say, I'm shaking the baby. Well, it's nothing worrisome, but it does feel kind of strange. Legs can shake. That will subside, but that initial shaking is very common after the birth. In this first hour, you're probably also going to be offered some snacks or juice, crackers, water by your team, because it's important to start rehydrating yourself if you haven't been hydrating properly in labor, or if you've had any kind of restrictions on liquid because of an epidural. Sometimes that happens. So it's a good time to really start drinking that water. If you brought snacks and you haven't eaten them, now is a good time to ask your partner to get out those yummy snacks and have a couple bites. It's good to have some snacks because if you are going to take any pain medication after after birth, which most people do, you want to have some snacks on your stomach, some food in your stomach before you take that medication. So immediately after the birth, you are holding baby, you're getting a repair, you might be doing some shaking. There's going to be lots of people in the room doing different things. There might be extra people in the room doing some different things. Then they're also going to freshen you up after the birth. Suggest that you put on a clean hospital gown afterwards. And even if you wear your own clothes in labor, sometimes it's nice to have a gown on after if you want. They might be changing some of the bedding underneath you. They might be changing pads underneath you. They'll probably be suggesting a ice pack is often put on your perineum below, and you might be able to see the wonderful mesh underwear that you've probably heard about. Put that on, and you might put the underwear on immediately if you're moving rooms, or you might wait and put that on later. So you will be probably repositioned in the bed after your repair is done so that you can better hold baby or work on that first latch, work on nursing. So there is kind of a freshening up, moving, resituating time. Also in that can happen in that first hour or two after birth. So hope you guys liked this video and you thought it was informative. I would love some comments down below to let me know if you have any questions about after the birth that I didn't cover, or any experiences you want to share with other people. Please enter them below. Hit that like button, and that helps other people see this video who might find it helpful. And subscribe and hit the notification bell, and you'll see when the next video is out. Thanks guys, bye.